Blood glucose should go up and should go down. It should go up because you're absorbing glucose from your intestine. It enters your bloodstream. It should go down because insulin comes up to meet it and forces that glucose into cells for utilization for energy or for storage in adipose tissue. That's what's supposed to happen. Unfortunately, as insulin becomes less effective, the blood sugar spike, the blood glucose spike goes up and stays up. When that happens, you have what is known as glucose intolerance. And glucose intolerance leads to multiple metabolic dysfunctions. The first is high blood glucose causes changes in the endothelial cells, the cells lining the arteries. And what happens is it causes them to constrict. This ultimately leads to an increase in blood pressure. It changes chemicals in your cells called nitric oxide or endothelin-1, things that normally would help you relax your blood vessels. In fact, it constricts those blood vessels and makes them much more tense and thereby increasing high blood pressure. So hypertension is a direct factor of inadequate glucose metabolism. Number 2, you've all heard of COVID. COVID the virus uses a water channel to be able to inject its virus into cells. The water channel is called ACE2, angiotensin converting enzyme 2. Well, when that channel is held open, more viruses can get in. Well, sugar, glucose, and fructose too, can actually form on the edges of that channel and crystallize and hold it open. And so you end up with increased water rushing in, and that can also increase blood pressure, and it can also increase susceptibility to COVID as well. One thing that people have not realized about the COVID epidemic is that the people who are most susceptible to morbidity and mortality are the people with pre-existing metabolic conditions, the ones we are talking about right now. That is metabolic syndrome, obesity, diabetes, fatty liver disease. These diseases are all the diseases of mitochondrial dysfunction, all the diseases of inadequate glucose metabolism in the mitochondria, and it manifests itself as dysfunctional immune regulation. So this is how you tie metabolism to immunology. Ultimately, when your metabolism has a problem, your whole body has a problem.